I wanted to talk to you about I know you have 4 books, correct? Based on, like, body image for both, like, adolescents and boys and girls. So, I've been doing research about how media affects adolescents, and the main thing that I focus on is, like, body image, and I recently did research on how undercovered, um, body image is with guys and how we don't really talk about it. So I wanted to talk to you about both men and like girls and boys and how they differ with body image. So I wanted to ask you in general, what are some surprising like findings or anything that you discovered about body image issues with men and women?
I think, you know, the I don't know if it's surprising. I've been doing this work for almost 30 years, so I don't know if
Mhm,
surprising is the right word at this point. But the pervasiveness of body dissatisfaction surprises a lot of people. I think
mhm,
for boys and men, oftentimes body dissatisfaction is manifested in behaviors that are apt to be perceived as healthy. So people see men at the gym or
mhm.
know, clean eating or whatever it may be. And it's not always a red flag that there may be disordered eating or body dysmorphia actually at play. So I
Mhm.
think that, just the pervasiveness in general is surprising. And also culturally, at least in the States, I can't speak to India per se. Um, a lot of disordered eating is normalized. So a lot of what psychologists would say this is maybe not a clinical eating disorder, but definitely disordered eating is even
Mhm.
prescribed sometimes by medical professionals or certainly by fad diets.
So I wanted to ask you, what is like the difference between disordered eating and having an eating disorder?
So, to be diagnosed with an eating disorder, um, most places will use the Diagnostic and Statistics Manual and follow the
Mhm.
criteria there. And the Diagnostic and Statistics Manual is updated, every I don't know, 5 or so years. It's a long, long process to try to
Mhm.
integrate the latest research and um, experts weigh in on what the diagnostic criteria for different disorders and psychological illnesses should be. So to be diagnosed, then there's usually this set of criteria that you have to be meeting. But when it
Mhm.
comes to body dissatisfaction and disordered eating, there's a lot of people in some research, it's up to almost 80% of like adolescent and young adult women, for example, who would not meet those criteria, right? They're not going to be defined
90%?
up to about 80% in some
Oh,
samples, like college
okay.
age samples, um, who still do things like, intentionally skip meals or um, maybe use substances sort of in place of food or purge
Mhm.
occasionally. So, not enough to be diagnosed as bulimic, but certainly these are maladaptive approaches to eating and trying to manage weight. So, that would be defined as disordered eating.
Okay, and I wanted to ask you about you did talk about, like, the role of parenting with body image, right? So could you talk a little bit about that and how it affects adolescents?
Yeah, so we find from a very young age that both girls and boys seem to pick up some of the language and behaviors that their parents and adults in their surrounding use to talk about food and bodies, and that there definitely is a correlation between parents who express disordered eating and body dissatisfaction in their kids. So, even just comments that are often very normalized about disliking one's own body are often picked up by younger people who then grow up accepting that it's sort of normal to dislike your own body.
Mhm. So if you have a parent who like, had like, if you grew up around a parent who had disordered eating, then you're more likely to care about it too.
Well,
Okay,
not care about it, but you're more likely to develop those same habits.
okay. And does that differ between men and women, or does it affect them in the same way?
We definitely have more research on young girls and adolescent girls and moms than we do boys and either moms or dads. But
Mhm.
definitely some of the research seems to suggest that this is across genders. I guess I would say with greater certainty that we see this with moms and daughters.
Okay. And do you think that going back to what you said about the diagnosing criteria, do you think that, like, family practitioners, like, people like the regular doctor that you would see for, like, a checkup, do you think that these doctors are, like, well trained in, like, being able to diagnose an eating disorder or any of that? Because from my own research, I found that a lot of family practitioners, they tend to not see any signs, and that's the main reason for underdiagnosis, right?
Yeah,
Mhm,
most general providers, people that at least in some countries is who you would go to first if you had a health concern. They receive about an hour of training maximum about these issues. And so they're really, really underqualified to make any kind of diagnoses. I mean, they're not psychiatrists or psychologists or even social workers.
mhm,
Um,
mhm.
they're they're medical professionals, and they should, when they have concerns, I think, make referrals to other specialists. But um, very often, because they've been trained in a very weight um, biased, I would say, weight biased sort of educational setting,
Mhm.
they will actually um, make suggestions that can exacerbate disordered eating.
Oh,
If
really?
Yeah, they will often make problems worse, not better, because they will talk about the importance of weight loss as integral to health,
Mhm,
when in fact it may not be appropriate for someone. If someone has a history of disordered eating, you're not going to prescribe weight loss. But if they don't understand that patient's history, then they could actually be doing more harm than good.
okay. And then, how does your research address, like, the influence of social media on body image?
Well, there's been a lot of research in the last decade or so on social media and body image. And I think we can say with certainty that, social media presents a risk factor. It doesn't
Mhm,
necessarily cause negative body image for everyone. And a lot
mhm,
of people would have a great deal of dissatisfaction with their bodies, whether or not they use social media. It's not like
mhm.
social media created something, this already existed before social media.
Yeah.
So it's really
Mhm,
more that social media seems to exacerbate some of these concerns by presenting imagery and information about ideal bodies, appearances, lifestyles that then, especially younger, more impressionable people, are seeking to achieve. There
mhm,
is some evidence from my own research that if social media is being used as a communication tool to connect with people and not to engage in sort of beauty, appearance, diet, fitness culture, that it may be much less likely to cause any kind of harm, right? Which I think is intuitive, makes some sense that if you're watching a lot of beauty tutorials, that may make you more self conscious about your appearance and more invested in your appearance. But if you don't do any of that, then, if you're sharing pictures of your pets, that's just not likely to be a huge risk
mhm.
factor in terms of mental health.
Okay. And I was curious, do you know the website named looksmax.org by
I've
any
heard of
chance?
it. Yes, I haven't explored it
You've
a
heard
lot.
of it?
Hmm.
So, it's this website where it's for men only. If you're female, you're not allowed into the organization, and it's basically, like, a bunch of men asking for tips on how to look better, how to lose weight, how to change like, get surgery. Some of them, like, consider getting surgery, like buccal fat removal to change how they look, and, um, I just wanna share with you because I think I saw people on that organization who were saying that they would take a hammer and put it on their face, like, hammer their face to grow more bone, so that their bones grow back stronger. So and whenever, like, I bring this up to someone, they're not really aware of it, and, yeah, I think it's, like, crazy how a lot of people don't think how guys are impacted with body image and the issues that they go through as well. So yeah.
Well, I think there's some history in the psychological literature to
Hmm.
suggest that boys and men tend to be a bit more extreme in their behaviors, and oftentimes both mental and physical health problems aren't
Hmm.
diagnosed until they're more serious. And so,
Hmm.
uh, because there's less of a help seeking culture, help seeking isn't often thought of as being very masculine. So,
Hmm.
we tend to see, whether it be substance use or eating disorders or suicidal ideation, that oftentimes the problems are worse by the time boys and men get access to treatment.
And do you know like which age specifically like people start to realize or seek out medical treatment?
I mean, we don't know per se like which age people are seeking out mental treatment. This is happening across the age spectrum. It depends on, exactly what mental health concern we're talking about. We do know that body image concerns tend to rise during puberty and the adolescent years, and there's some indication that they kind of plateau or don't necessarily get worse then after that. They don't necessarily get better either.
Okay. And sorry, I'm just checking my notes. Um, have you discovered any significant changes in how like cultural shifts differ like between men and like are is a guy more impacted by the culture around him compared to a girl, or is it equal?
No, I
You know?
wouldn't say so. No, I think that um, if anything, some of the gender differences in the literature seem to suggest that women may be more impacted, and that women have been socialized for generations to be caretakers and people pleasers and to be valued for their
Mhm.
appearance, and that unfortunately persists. And so, um, the sociocultural sort of messaging that women and girls receive is likely to be internalized, I think, more so than with boys and men.
And have you received like a lot of feedback from young adolescent boys about your books? Like, have you heard like of like are they open to reading and like learning more about their own issues, or are they more hesitant?
Yeah, it's interesting that both in writing the books and since they've been written, that um, girls and women are very comfortable talking about these issues. And when I do
Hmm.
interviews for the books, even, I can talk to a 12-year-old girl and she will have thought about this and she'll have things to say. She'll be ready to go.
Hmm.
And if I talk to a young boy, who's 12 or 13, 14, he'll just be like, I don't know what you're talking about, or that's not relevant to me.
Oh,
Um,
really?
yeah, it really seems to take boys longer to appreciate the relevance of these issues to them. They
Hmm.
can, even say like, "Oh, body image is a girl thing," and then go on to tell me about their diet they're on. So there's a
Hmm.
lot of sort of contradictions in their thinking because they don't want to associate, I think, their own behaviors with femininity or what's appreciated as being more feminine behaviors.
Yeah, because I've I've definitely seen online that people label like eating disorders or body dysmorphia as a feminine thing. And it's like, you're right, it's not masculine for them to go forward and talk about their own issues. Even like excluding like just in general, not even with body image, men are more embarrassed to like go to a therapist, right? Or admit that they go to a therapist.
Yeah,
So
any
yeah.
sort of help seeking. We also, though, see a really huge discrepancy in pursuit of cosmetic surgery, for example. So I was just re-looking at statistics for just this last year in the United States, and 93% of minimally invasive and surgical cosmetic procedures are pursued by women. So that
Mhm.
suggests that although there are some men who are self-conscious enough to go actually see either a dermatologist or a cosmetic surgeon for these sorts of procedures, this is still very female dominated.
This is 93% of men who seek out
No,
surgical procedures?
93% of women. When you
Oh,
take 100% of procedures, 93% of them are
mhm.
pursued by girls and women.
Oh, okay. I see. Um, and then I wanted to ask you, I wasn't able to like read in depth or like get to read your books, but um, did you talk about the connection between like romantic relationships and body image? So could you talk to
Yeah.
me about that?
I guess it depends on, it's a very broad question, so I'm not sure where to start.
Like how do the dynamics in romantic relationships like differently affect boys and girls like self-perception? Like are girls more affected by like their romantic relationships?
Well, like I said, girls are socialized to believe that their value is associated with their appearance more so than boys and men are. And we definitely see girls, well, really, in some of my own research, we've seen women, young women, who feel that their partners are not satisfied with their appearance, even though they are. So there's some of this is actually, in the women's heads that they misunderstand their partner's perceptions of their appearance.
And do men feel the same way? Like, oh, my partner isn't
No,
happy with how I look.
we don't really have data to support that right now. So I don't know if it's that it doesn't exist or if just the work hasn't been done yet. It didn't appear in our research when we examined that.
Okay. And then just a few final questions. What do you recommend for like young adolescent boys, like if they're considering that maybe they do have a like body dysmorphia or some type of issue? Like what do you recommend, like how do you recommend they seek help for that?
So I think it's really important. These issues, when they become actual eating disorders, the fatality rate is 10 to 20%. So it has eating disorders have a really high, the highest fatality rate for mental health illnesses. So
Mhm,
treatment and early treatment is really important. So even if someone isn't really sure if they have
mhm,
a problem, it's better to get treatment in sort of a preventative way than to wait and see, right, if things get better. So it's really essential that if people are concerned, they find professionals that have some expertise in this area.
mhm.
It's not necessarily going to be as useful if someone seeks out, therapy or medical advice from a professional that has no training in this area, because these are pretty complex issues.
Mhm. You said that the fatality rate was 20% for
10 to 20%.
10 to 20. Is that from, do you know if like that's from bulimia or anorexia? Like what is it specifically?
It's across the disorders. That's the estimate that's used. It's not usually a direct result of starvation or malnutrition, but starvation and malnutrition really wreak havoc on all body systems. So people can have a cardiac event, for example, that would
Mhm.
lead to death sort of unexpectedly.
Okay. Um, so yeah, that's all I wanted to ask. Just like some
Okay.
few general questions. And thank you so much for your time.
Okay. All
And
right. Great. Take care.
have a good day. Thank you.
You too.